Question 1. Governance review demonstrates a need to reinforce foundational anatomical knowledge among certified phlebotomy technicians. Considering the structure of the heart and its role in the circulatory system, which of the following statements best reflects an understanding that is most directly applicable to the context of peripheral venipuncture and patient safety? Option A. The aortic valve regulates the flow of oxygenated blood from the left ventricle into the aorta. Option B. The left ventricle is responsible for pumping oxygenated blood to the rest of the body. Option C. The right atrium receives deoxygenated blood from the body and is connected to the tricuspid valve and right ventricle. Option D. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. Correct answer is C. The right atrium receives deoxygenated blood from the body and is connected to the tricuspid valve and right ventricle. Explanation. Scenario analysis. This scenario presents a challenge in applying foundational anatomical knowledge to a practical phlebotomy context. While phlebotomy technicians are not expected to be cardiologists, a basic understanding of the heart structure is crucial for recognizing potential complications during venipuncture, such as the proximity of certain veins to vital structures or the implications of patient conditions related to cardiac function. The challenge lies in translating theoretical anatomical knowledge into safe and effective patient care, ensuring that the technician's actions are informed by an understanding of the body's internal workings. Correct approach analysis. The correct approach emphasizes the importance of understanding the right atrium's role in receiving deoxygenated blood from the body and its direct connection to the tricuspid valve and right ventricle. This knowledge is relevant to phlebotomy because it underscores the systemic circulation of blood. While a phlebotomy technician might not directly interact with the right atrium during a standard venipuncture, understanding this part of the cardiac cycle reinforces the concept of blood flow and the body's circulatory system, which is foundational for safe practice. It promotes a holistic view of patient physiology, which can inform decisions about patient positioning, potential complications, and the overall significance of the blood sample being collected. This aligns with the ethical principle of beneficence, ensuring the patient's well-being by performing procedures with informed awareness. Incorrect approaches analysis. One incorrect approach might focus on the left ventricle's role in pumping oxygenated blood to the body. While anatomically correct, this detail is less directly relevant to the immediate mechanics and safety considerations of a typical peripheral venipuncture, compared to understanding the general flow of blood returning to the heart. It represents a failure to prioritize the most pertinent anatomical information for the specific task. Another incorrect approach could highlight the pulmonary artery's function in carrying deoxygenated blood to the lungs. Again, while factually accurate, this information is more directly related to pulmonary circulation and less to the venous system commonly accessed for phlebotomy. This demonstrates a lack of focus on the practical application of anatomical knowledge to the phlebotomy procedure. A further incorrect approach might detail the function of the aortic valve in regulating blood flow from the left ventricle. This is a critical component of systemic circulation, but is not directly related to the veins typically accessed for blood draws. Focusing on this aspect shows a disconnect between theoretical knowledge and its practical application in phlebotomy, potentially leading to an incomplete understanding of the immediate physiological context of the procedure. Professional reasoning. Professionals should approach such questions by first identifying the core task, phlebotomy, and then considering which aspects of cardiac anatomy are most relevant to that task. This involves understanding the venous system, blood flow patterns, and potential patient conditions that might impact venipuncture. The decision-making process should prioritize knowledge that directly contributes to patient safety, procedural accuracy, and an understanding of the physiological significance of the collected sample. When faced with anatomical information, the professional should ask, how does this knowledge directly inform my ability to perform a safe and effective phlebotomy procedure? Question 2. Investigation of a needle stick injury that occurred during a routine venipuncture procedure, where the phlebotomist immediately washed the affected area with soap and water for several minutes. What is the most appropriate next step according to standard phlebotomy safety protocols and regulatory guidelines for preventing potential transmission of bloodborne pathogens? Option A. Wash the area again and wait until the end of the shift to report the incident to a supervisor. Option B. Immediately report the incident to a supervisor and seek prompt medical evaluation for potential post-exposure prophylaxis. Option C. Discard the contaminated sharps container and wash the area thoroughly before resuming patient care. Option D. Apply a bandage to the wound and continue with the remaining patient care duties for the day. The correct answer is B. Immediately report the incident to a supervisor and seek prompt medical evaluation for potential post-exposure prophylaxis. Explanation: scenario analysis. This scenario presents a common yet critical situation in phlebotomy, a needle stick injury. The professional challenge lies in the immediate, correct management of the injury to minimize the risk of pathogen transmission and comply with established safety protocols. The phlebotomist's actions directly impact their own health and potentially the health of the patient if further exposure occurs. Careful judgment is required to ensure all necessary steps are taken promptly and accurately. Correct approach analysis. The correct approach prioritizes immediate, thorough washing of the affected area with soap and water, followed by reporting the incident to a supervisor and seeking immediate medical evaluation. This aligns with standard post-exposure prophylaxis (PEP) guidelines and regulatory requirements for workplace safety, such as those outlined by the Occupational Safety and Health Administration (OSHA) in the United States. Prompt reporting ensures proper documentation, facilitates timely medical assessment and treatment, and allows for investigation into the cause to prevent future occurrences. This comprehensive approach is best professional practice as it directly addresses the immediate health risk to the phlebotomist and adheres to legal and ethical obligations to maintain a safe working environment. Incorrect approaches analysis. One incorrect approach involves simply applying a bandage and continuing with patient care without reporting the incident. This is a significant regulatory and ethical failure. It violates OSHA standards, requiring prompt reporting of all work-related injuries and exposures. Ethically, it demonstrates a disregard for personal safety and a failure to follow established protocols designed to protect healthcare workers. It also prevents the necessary medical evaluation and potential PEP, increasing the risk of infection. Another incorrect approach is to immediately discard the needle and wash the area, but delay reporting the incident until the end of the shift. A washing is a crucial first step. Delaying reporting is a regulatory failure. OSHA mandates prompt reporting to ensure timely intervention. Ethically, this delay can compromise the effectiveness of PEP, as certain treatments are most effective when initiated within a specific time frame after exposure. It also hinders the facility's ability to conduct a timely incident investigation. A third incorrect approach is to wash the area and then immediately seek medical attention at an urgent care clinic without informing a supervisor. While seeking medical attention is correct, bypassing the facility's established reporting structure is a procedural and potentially regulatory failure. Facilities typically have specific protocols for managing needle stick injuries, including designated reporting channels, and often partnerships with specific medical facilities for evaluation and treatment. Failing to follow these internal procedures can lead to delays in proper documentation and may not align with the facility's established PEP plan, which is often a regulatory requirement. Professional reasoning. Professionals should approach needle stick injuries with a clear step-by-step protocol. First, immediate self-care washing is paramount. Second, prompt reporting to a supervisor is non-negotiable, as it triggers the facility's established safety and medical management procedures. Third, following the facility's guidance for medical evaluation and potential PEP is crucial. This systematic approach ensures compliance with regulations, prioritizes personal health, and contributes to a safer work environment for all. Question 3. What factors determine the most appropriate venipuncture technique and communication strategy when collecting blood from pediatric and geriatric patients? Option A. The phlebotomist's personal preference for vein selection and the availability of standard venipuncture equipment. Option B. The urgency of the laboratory results and the phlebotomist's familiarity with adult venipuncture procedures. Option C. The patient's body mass index and the phlebotomist's comfort level with performing difficult draws. Option D. The patient's age, vein accessibility, patient cooperation level, and the specific laboratory tests ordered. The correct answer is D. The patient's age, vein accessibility, patient cooperation level, and the specific laboratory tests ordered. Explanation. This scenario is professionally challenging because phlebotomists must adapt their techniques and communication to the unique physiological and psychological needs of pediatric and geriatric patients, ensuring both patient safety and specimen integrity. Failure to do so can lead to patient distress, inaccurate results, and potential harm. The correct approach emphasizes a patient-centered strategy that prioritizes comfort, trust, and appropriate specimen collection. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulatory guidelines for phlebotomy technicians, such as those outlined by CLIA, Clinical Laboratory Improvement Amendments, and OSHA, Occupational Safety and Health Administration, in the U.S., mandate that procedures are performed in a manner that ensures patient safety and specimen quality. Specifically, these regulations implicitly require that technicians possess the knowledge and skills to handle diverse patient populations, including vulnerable groups like children and the elderly. Adapting collection methods, using appropriate equipment, and employing effective communication are essential for meeting these standards. An incorrect approach that relies solely on standard adult venipuncture techniques without modification fails to acknowledge the specific vulnerabilities of pediatric and geriatric patients. For pediatric patients, this can lead to increased anxiety, pain, and potential for hematoma formation due to smaller, more fragile veins. For geriatric patients, fragile skin, decreased venous elasticity, and potential for bruising or nerve damage necessitate a gentler, more experienced approach. Ignoring these differences violates the principle of non-maleficence and can lead to adverse patient outcomes, potentially resulting in regulatory citations for improper patient care. Another incorrect approach that prioritizes speed over patient comfort and communication overlooks the importance of building rapport, especially with children who may be fearful or with elderly patients who may have cognitive impairments or hearing difficulties. This can result in patient resistance, increased difficulty in obtaining a sample, and a negative patient experience, which indirectly impacts specimen quality and patient trust. Regulatory bodies expect phlebotomists to employ best practices that include effective patient interaction. A third incorrect approach that involves using excessive force or inappropriate equipment, such as standard-sized needles on a child's small vein, directly contraindicates the principle of non-maleficence and can cause significant pain, injury, and specimen hemolysis. This demonstrates a lack of understanding of pediatric anatomy and physiology and would be a clear violation of safety protocols and patient care standards. The professional decision-making process for similar situations should involve a thorough assessment of the patient's age, physical condition, and emotional state. This assessment should guide the selection of appropriate equipment, e.g., smaller gauge needles, butterfly needles, collection techniques, e.g., positioning, site selection, and communication strategies, e.g., age-appropriate explanations, distraction techniques. Always adhering to established phlebotomy protocols while demonstrating flexibility and empathy is paramount. Question 4. When evaluating a phlebotomy procedure, which of the following actions best demonstrates adherence to standard precautions and infection control measures in a scenario where a patient expresses mild discomfort with the idea of wearing gloves? Option A. Proceed with the venipuncture without wearing gloves, assuring the patient that you are careful. Option B. Perform hand hygiene, don gloves, and proceed with the venipuncture, explaining to the patient that the gloves are a necessary safety measure for both of you. Option C. Skip hand hygiene before donning gloves, as the gloves will provide a barrier. Option D. Reuse the same pair of gloves for multiple patients to save time and reduce waste. The correct answer is B. Perform hand hygiene, don gloves, and proceed with the venipuncture, explaining to the patient that the gloves are a necessary safety measure for both of you. Explanation. This scenario presents a common implementation challenge in phlebotomy, maintaining strict adherence to standard precautions when faced with a perceived time constraint or a patient's discomfort. Professional challenge lies in balancing the need for efficient patient care with the non-negotiable requirement of infection prevention. A phlebotomist must exercise sound judgment to ensure patient safety and prevent the transmission of pathogens, even when faced with minor obstacles. The correct approach prioritizes patient and healthcare worker safety by strictly following established protocols for hand hygiene and personal protective equipment, PPE, use. This aligns directly with the fundamental principles of standard precautions, which are designed to prevent the spread of infection by treating all blood and bodily fluids as potentially infectious. Regulatory bodies and certification standards for phlebotomists universally emphasize these practices as critical for safe patient care. Adhering to these guidelines is not merely a procedural step, but an ethical and legal obligation to protect both the patient and the healthcare provider. An incorrect approach that bypasses hand hygiene before donning gloves is a direct violation of standard precautions. This failure significantly increases the risk of transmitting microorganisms from the phlebotomist's hands to the patient, or from a previous patient to the current one, even if gloves are subsequently worn. It demonstrates a lack of understanding or disregard for the foundational principles of infection control. Another incorrect approach, failing to wear gloves when collecting blood, is a severe breach of standard precautions. This exposes both the phlebotomist and potentially other individuals to bloodborne pathogens, creating a high risk of infection transmission. This action is a clear violation of regulatory requirements and ethical responsibilities. Lastly, an incorrect approach that involves reusing a single pair of gloves for multiple patients is a critical failure in infection control. Gloves are single-use items and must be changed between patients to prevent cross-contamination. Reusing gloves is a direct pathway for pathogen transfer and represents a gross negligence in patient care. Professionals should employ a decision-making process that begins with a thorough understanding of standard precautions and their rationale. When faced with a situation that might tempt a deviation from protocol, the professional should pause and consider the potential consequences. This involves asking, what is the safest course of action for the patient and myself, according to established guidelines? The answer should always be to follow the established protocols, even if it requires a few extra seconds. This systematic approach ensures that patient safety and infection control remain paramount, overriding any perceived inconveniences or time pressures. Question 5. Compliance review shows a phlebotomy technician is preparing to draw blood from a patient with visible signs of venous distension in both antecubital fossae. One potential venipuncture site appears to be a large, prominent vein, but it is located very superficially and feels somewhat fragile upon palpation. Another potential site is a deeper vein that is less prominent but feels more resilient and stable. The technician also notes a slight discoloration and puffiness around a third potential site in the forearm. Which of the following approaches best demonstrates adherence to best practices for venipuncture site selection? Option A. Choose the large, prominent vein in the antecubital fossa, even if it feels fragile. Option B. Attempt venipuncture in the forearm area exhibiting slight discoloration and puffiness. Option C. Prioritize the superficial, prominent vein in the antecubital fossa due to its easy visibility. Option D. Select the deeper, more resilient vein in the antecubital fossa that feels stable upon palpation. The correct answer is C. Prioritize the superficial, prominent vein in the antecubital fossa due to its easy visibility. Explanation. Scenario analysis. This scenario presents a common implementation challenge in phlebotomy, ensuring patient safety and specimen integrity when dealing with variations in vascular anatomy. The challenge lies in selecting the most appropriate venipuncture site, which requires a thorough understanding of blood vessel characteristics and potential complications, while adhering to established protocols and patient comfort. Correct approach analysis. The correct approach prioritizes patient safety and the quality of the blood sample, selecting a vein based on its size, depth, and resilience, and avoiding areas with signs of compromised circulation or potential for nerve damage, directly aligns with the principles of safe and effective phlebotomy, as outlined by regulatory bodies governing certified phlebotomy technicians. This approach minimizes the risk of complications such as hematoma, nerve injury, or arterial puncture, and ensures the collected specimen is suitable for diagnostic testing. Incorrect approach is analysis. Choosing a vein solely based on its prominence without considering its depth or resilience can lead to a difficult draw, increased patient discomfort, and a higher risk of hematoma formation. This disregards the need for a stable venipuncture site. Attempting venipuncture in an area with visible signs of edema or inflammation is a direct violation of safety protocols. Such areas indicate compromised tissue integrity, increasing the risk of infection, hematoma, and a potentially inaccurate sample due to altered blood composition. Selecting a vein that feels hard and cord-like suggests potential venous disease or damage, making venipuncture risky and potentially painful for the patient. This approach fails to assess the health of the vein, prioritizing ease of access over patient well-being. Professional reasoning. Certified phlebotomy technicians must employ a systematic approach to site selection. This involves visual inspection, palpation to assess vein characteristics, size, depth, resilience, and consideration of the patient's medical history and current condition. When faced with multiple potential sites, the technician should always choose the site that offers the best balance of accessibility, patient comfort, and safety, while minimizing the risk of complications and ensuring specimen integrity. This decision-making process is guided by established phlebotomy standards and the ethical obligation to provide competent and safe patient care. Question 6. Benchmark analysis indicates that patient preparation is a critical determinant of laboratory test accuracy. A phlebotomist is preparing to collect a blood sample for a lipid panel and a fasting glucose test. The patient states, "I just had a small piece of toast and some coffee about an hour ago because I was feeling a bit lightheaded." What is the most appropriate immediate action for the phlebotomist to take? Option A. Ask the patient if they have any medications that might affect the lipid panel or glucose levels, and proceed with the draw if no medications are mentioned. Option B. Proceed with the blood draw as scheduled, as the patient is ready and the quantity of food was small. Option C. Inform the patient that the fasting requirements have not been met and reschedule the blood draw for a later time after proper fasting. Option D. Draw the blood immediately and document that the patient consumed food and coffee approximately 1 hour prior to collection. The correct answer is B. Proceed with the blood draw as scheduled, as the patient is ready and the quantity of food was small. Explanation. Scenario analysis. This scenario presents a common challenge in phlebotomy where a patient's medical history directly impacts the validity of laboratory test results. The phlebotomist must balance patient comfort and cooperation with the critical need for accurate diagnostic information. Failure to properly assess and address potential interferences from medication or dietary status can lead to misdiagnosis, inappropriate treatment, and patient harm, all of which have significant ethical and regulatory implications. Correct approach analysis. The correct approach involves a thorough pre-collection assessment of the patient's adherence to fasting and medication instructions. This aligns with the fundamental principle of ensuring specimen integrity, a cornerstone of laboratory medicine and phlebotomy practice. Regulatory bodies, such as those overseeing clinical laboratory standards, e.g., CLIA in the U.S., mandate that phlebotomists take steps to ensure the quality of collected specimens. This includes verifying patient preparation to prevent pre-analytical errors. Ethically, the phlebotomist has a duty to provide competent care, which includes understanding and mitigating factors that could compromise test results. By confirming the patient's fasting status and inquiring about relevant medications, the phlebotomist acts proactively to safeguard the accuracy of the diagnostic process. Incorrect approaches analysis. One incorrect approach is to proceed with the draw without verifying fasting status, assuming the patient has followed instructions. This is a regulatory failure because it bypasses a critical step in specimen integrity assurance. Many common tests, such as glucose and lipid panels, are highly sensitive to recent food intake, and unverified fasting can render results invalid, leading to potential misinterpretation by the physician. Ethically, this demonstrates a lack of due diligence and a failure to uphold the duty of care. Another incorrect approach is to administer the blood draw and then inform the patient about fasting requirements afterward. This is both a regulatory and ethical failure. It violates the principle of obtaining a valid specimen from the outset. Informing the patient post-draw is too late to correct the pre-analytical error, and the collected specimen will likely be unusable for the intended tests. This also creates unnecessary inconvenience and potential anxiety for the patient. A third incorrect approach is to ignore the patient's mention of a recent meal, proceeding with the draw because the patient is ready and the phlebotomist is on schedule. This is a significant regulatory and ethical lapse. It prioritizes efficiency over accuracy and patient safety. Ignoring patient-reported information that directly impacts test validity is a failure to collect a quality specimen and can lead to serious diagnostic errors. It also undermines patient trust and the phlebotomist's professional integrity. Professional reasoning. When faced with a patient requiring laboratory testing, the phlebotomist's decision-making process should begin with a clear understanding of the specific tests ordered and their associated preparation requirements. This involves consulting laboratory manuals or protocols. The next step is to engage the patient in a brief but comprehensive pre-collection interview, confirming adherence to fasting, hydration, and any medication restrictions relevant to the ordered tests. If any discrepancies are identified, the phlebotomist must communicate these findings to the ordering physician or laboratory supervisor to determine the appropriate course of action, which may include rescheduling the draw or proceeding with a note of the deviation. This systematic approach ensures specimen integrity, supports accurate diagnosis, and upholds ethical and regulatory standards. Question 7. The audit findings indicate that a phlebotomist was observed cleaning up a small blood spill on a countertop using only paper towels, and then discarding these towels in a standard waste bin, without using a designated biohazard spill kit or ensuring proper labeling for regulated medical waste. Which of the following actions should the phlebotomist have taken immediately following the spill, according to regulatory guidelines for biohazard waste disposal? Option A. Dispose of the contaminated paper towels in the regular trash bin after wiping up the spill. Option B. Rinse the spilled blood down the sink with water to dilute it before wiping the area. Option C. Wipe up the spill with paper towels and immediately discard them in a biohazard-designated trash receptacle without further containment or labeling. Option D. Use a designated biohazard spill kit to contain and clean the spill. Then package and label all contaminated materials as regulated medical waste for proper disposal. Correct answer is D. Use a designated biohazard spill kit to contain and clean the spill, then package and label all contaminated materials as regulated medical waste for proper disposal. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct observation of a potential breach in biohazard waste disposal protocols, which carry significant risks to public health, environmental safety, and the reputation of the healthcare facility. The phlebotomist must act decisively and correctly to mitigate immediate risks and prevent future occurrences, all while adhering to strict regulatory requirements. Correct approach analysis. The correct approach involves immediate containment of the spilled biohazard material using appropriate personal protective equipment, PPE, and designated biohazard spill kits. Following this, the waste must be segregated, packaged, and labeled according to OSHA Bloodborne Pathogen Standard 29 CFR 1910-1030, and any relevant state or local regulations for regulated medical waste. Proper disposal through a licensed medical waste disposal service is paramount. This approach represents best professional practice because it directly addresses the immediate hazard, prevents further contamination, and ensures compliance with federal and state regulations designed to protect healthcare workers and the public from infectious diseases. Adherence to these protocols is a core ethical and legal responsibility of a certified phlebotomy technician. Incorrect approaches analysis. Disposing of the spilled material in the regular trash is a severe regulatory and ethical failure. This directly violates OSHA Bloodborne Pathogen Standard, which mandates specific handling and disposal procedures for regulated medical waste. It poses a significant risk of exposure to infectious agents for waste handlers and the general public, and could lead to legal penalties and disciplinary action. Rinsing the spilled material down the sink is also a critical regulatory and ethical failure. This practice can contaminate the facility's plumbing system and potentially the municipal water supply, posing a public health risk. It bypasses the necessary steps for inactivation or containment of biohazardous agents and is a violation of environmental protection regulations and OSHA standards. Simply wiping up the spill with paper towels and discarding them in a regular trash without proper containment and labeling is insufficient. While it addresses the immediate mess, it fails to meet the requirements for regulated medical waste disposal. The paper towels are now contaminated and must be treated as biohazard waste, requiring specific packaging and disposal methods to prevent exposure. This approach demonstrates a lack of understanding of biohazard containment and disposal protocols. Professional reasoning. When faced with a biohazard spill, a phlebotomist must prioritize immediate safety and regulatory compliance. The decision-making process should involve 1. Assessing the immediate hazard and ensuring personal safety with appropriate PPE. 2. Containing the spill using designated biohazard spill kits. 3. Following established facility protocols for cleaning and disinfection. 4. Properly packaging and labeling all contaminated materials as regulated medical waste. 5. Arranging for disposal by a licensed medical waste contractor. This systematic approach ensures that all regulatory requirements are met and that the risk of exposure is minimized. Question 8. The assessment process reveals that while attempting to collect a venous blood sample for routine coagulation studies, a patient suddenly becomes pale, diaphoretic, and reports feeling dizzy and nauseous. The phlebotomist observes that the patient's skin is cool and clammy. What is the most appropriate immediate action for the certified phlebotomy technician to take? Option A. Ask the patient to take deep breaths and try to relax, then proceed with the collection. Option B. Complete the venipuncture quickly and then inform the nurse about the patient's symptoms. Option C. Immediately cease the venipuncture, remove the needle, and alert a nurse or physician to the patient's condition. Option D. Continue the venipuncture to ensure the sample is collected, as coagulation studies are time-sensitive. The correct answer is C. Immediately cease the venipuncture, remove the needle, and alert a nurse or physician to the patient's condition. Explanation. The assessment process reveals a scenario where a phlebotomist is faced with a patient experiencing a potential medical emergency that directly impacts the integrity of a blood sample crucial for diagnostic testing. This situation is professionally challenging because it requires the phlebotomist to balance immediate patient safety with the accurate and timely collection of a specimen. The phlebotomist must make a rapid, informed decision that prioritizes the patient's well-being, while also adhering to established protocols for specimen integrity and patient care. The correct approach involves recognizing the signs of a potential hemostatic or coagulation issue that could compromise the blood draw and the patient's health. This approach prioritizes patient safety by immediately ceasing the venipuncture and alerting the appropriate medical personnel. This aligns with the fundamental ethical principle of do no harm, non-maleficence, and the regulatory requirement to ensure patient safety during phlebotomy procedures. Promptly notifying a nurse or physician allows for immediate assessment and intervention for the patient's condition, which could be life-threatening. Furthermore, by stopping the phlebotomist prevents potential complications from the venipuncture itself in a compromised patient and avoids collecting a potentially inaccurate or unusable sample due to the patient's condition. This upholds the professional standard of care and ensures that diagnostic results, if obtained, are reliable. An incorrect approach would be to proceed with the venipuncture despite the patient's alarming symptoms. This is a significant regulatory and ethical failure. Proceeding would violate the principle of non-maleficence, as it could exacerbate the patient's condition or cause further harm. It also demonstrates a failure to adhere to the phlebotomist's scope of practice, which includes recognizing and responding to patient distress. Furthermore, collecting a blood sample from a patient in such a compromised state could yield inaccurate laboratory results, leading to misdiagnosis and inappropriate treatment, thereby failing the principle of beneficence acting in the patient's best interest. Another incorrect approach would be to ignore the symptoms and complete the draw without informing anyone. This is a failure of professional responsibility and communication, which are critical components of patient care and regulatory compliance. It neglects the immediate need for medical assessment and intervention, potentially delaying critical care. Professional decision-making in such situations requires a systematic approach. 1. Recognize and assess the patient's condition for any signs of distress or complications. 2. Prioritize patient safety above all else. 3. Follow established protocols for managing adverse events during phlebotomy. 4. Communicate effectively with the patient and other healthcare professionals. 5. Document the event and actions taken accurately. Question 9. Quality control measures reveal that a blood sample collected for routine chemistry analysis has a visibly cloudy or turbid plasma layer. The phlebotomy technician recalls that the patient had recently consumed a fatty meal. Which of the following actions best ensures the integrity of the patient's laboratory results and adheres to best practices for specimen handling? Option A. Note the cloudiness in the report but proceed with testing the whole sample without further action. Option B. Centrifuge the sample and proceed with testing the clear serum layer, assuming the cloudiness is an artifact that will be removed. Option C. Reject the sample, document the observation of turbid plasma, and request a new sample from the patient, advising them to fast prior to collection. Option D. Proceed with testing the sample, as the cloudiness is likely due to lipemia, which may have minimal impact on most chemistry tests. The correct answer is D. Proceed with testing the sample as the cloudiness is likely due to lipemia, which may have minimal impact on most chemistry tests. Explanation. Scenario analysis. This scenario presents a challenge in maintaining the integrity of a blood sample for diagnostic purposes. The technician must recognize that deviations in the appearance of blood components can indicate pre-analytical errors, which can lead to inaccurate test results and potentially misdiagnosis or inappropriate treatment. The professional challenge lies in identifying the cause of the observed abnormality and taking immediate corrective action to ensure patient safety and the reliability of laboratory data. Correct approach analysis. The correct approach involves recognizing that a significantly increased number of white blood cells, leukocytosis, can alter the visual appearance of a blood sample, potentially making the plasma appear cloudy or turbid. This observation necessitates further investigation to confirm the presence of leukocytosis and its potential impact on the intended laboratory tests. Following established protocols for sample rejection or recollection when pre-analytical variables are compromised is crucial for maintaining the quality of patient care and adhering to CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate quality control and assurance in laboratory testing. This ensures that results are accurate and reliable. Incorrect approaches analysis. One incorrect approach is to proceed with testing the sample without further investigation. This violates CLIA regulations regarding specimen integrity and quality control. If the leukocytosis is significant, it could interfere with various analytical procedures, leading to erroneous results. For example, elevated white blood cells can affect spectrophotometric readings in some chemistry tests. Another incorrect approach is to simply discard the sample without documenting the observation or attempting to recollect. A recollection might be necessary. Simply discarding it without proper documentation fails to identify potential systemic issues or trends that might be occurring in sample collection or handling. It also bypasses the opportunity to inform the healthcare provider about a potential clinical finding, leukocytosis, that may require further medical attention. A third incorrect approach is to assume the cloudiness is due to lipemia and proceed with testing. While lipemia, increased lipids, can also cause turbidity, it is a different pre-analytical issue with different implications for testing. Mistaking leukocytosis for lipemia means the actual cause of the turbidity is not addressed, and the potential clinical significance of leukocytosis is missed. This demonstrates a failure in accurate visual assessment and adherence to diagnostic principles. Professional reasoning. Professionals should employ a systematic approach to sample evaluation. Upon observing any deviation from normal appearance, the technician should 1. Visually inspect the sample for signs of hemolysis, lipemia, or abnormal cellularity. 2. Correlate the visual observation with the patient's clinical information if available. 3. Consult laboratory protocols for handling visually abnormal samples. 4. If necessary, reject the sample and request a recollection, documenting the reason for rejection. 5. Communicate findings to the appropriate personnel, e.g., supervisor, physician, as per protocol. This decision-making process prioritizes patient safety, diagnostic accuracy, and regulatory compliance. Question 10. The control framework reveals a phlebotomist is preparing to draw blood from a patient in a hospital room. The patient is conscious and able to respond. Which of the following actions best ensures accurate patient identification according to standard phlebotomy protocols and patient safety guidelines? Option A. Proceeding with the blood draw after the nurse has verbally confirmed the patient's identity to the phlebotomist from the doorway. Option B. Confirming the patient's identity by checking their room number and visually observing their general appearance. Option C. Asking the patient to state their full name and date of birth, and comparing this information to their identification wristband and the requisition form. Option D. Relying on the information provided by a family member present in the room to confirm the patient's identity. The correct answer is C. Asking the patient to state their full name and date of birth, and comparing this information to their identification wristband and the requisition form. Explanation. Scenario analysis. This scenario is professionally challenging because a phlebotomist must balance efficiency with the absolute necessity of patient safety. Misidentifying a patient can lead to severe clinical errors, including incorrect diagnoses, inappropriate treatments, or even life-threatening adverse events. The pressure to maintain workflow speed in a busy healthcare setting can create a temptation to cut corners, making rigorous adherence to identification protocols paramount. Correct approach analysis. The correct approach, which involves a multi-step verification process using at least 2 unique patient identifiers and direct patient confirmation, represents best professional practice because it directly aligns with the core principles of patient safety and regulatory compliance. Regulations, such as those enforced by CLIA, Clinical Laboratory Improvement Amendments, in the U.S., mandate strict patient identification procedures to ensure the accuracy and reliability of laboratory testing. Ethically, it upholds the principle of do no harm by minimizing the risk of medical errors. This method provides multiple checks and balances, significantly reducing the likelihood of a misidentification event. Incorrect approach is analysis. Failing to obtain verbal confirmation from the patient, relying solely on visual cues or wristband information without direct patient engagement, is a significant regulatory and ethical failure. This bypasses a critical verification step, increasing the risk of error if the wristband is incorrect or if the phlebotomist is not directly interacting with the patient to confirm their identity. It violates the principle of informed consent and patient autonomy by not directly involving the patient in their own identification. Accepting identification from a family member or caregiver without independent verification from the patient themselves is also a critical failure. While well-intentioned, this introduces an intermediary who may be mistaken or have incomplete information. It deviates from established protocols designed to ensure the highest level of accuracy and can lead to serious breaches in patient safety, violating regulatory requirements for direct patient identification. Proceeding with the draw based on a patient's room number or location within the facility is a severe regulatory and ethical lapse. Room numbers can change, patients can be moved, and this method offers no unique identifier tied to the individual. It is a direct violation of patient identification standards and demonstrates a profound disregard for patient safety, potentially leading to the collection of specimens from the wrong individual. Professional reasoning. Professionals should employ a systematic decision-making process that prioritizes patient safety above all else. This involves 1. Understanding and internalizing all relevant institutional policies and regulatory requirements for patient identification. 2. Implementing a consistent multi-step verification process for every patient encounter. 3. Actively engaging the patient in the identification process, seeking their verbal confirmation. 4. Recognizing and addressing any potential barriers to identification, e.g., unconscious patient, language barrier, and following established protocols for these situations. 5. Never compromising on identification procedures, even under pressure, and escalating concerns if protocols cannot be followed safely. Question 11. Market research demonstrates that a significant percentage of laboratory errors originate in the pre-analytical phase. A phlebotomy technician is preparing to collect a blood sample from a patient for a routine chemistry panel. Upon reviewing the patient's wristband and the requisition form, the technician notices a slight discrepancy in the patient's date of birth between the two documents, though the name and medical record number match perfectly. The technician has been trained on the importance of accurate patient identification for preventing pre-analytical errors. What is the most appropriate course of action to mitigate this pre-analytical risk? Option A. Proceed with the blood draw as scheduled, assuming the name and medical record number are sufficient for accurate identification. Option B. Collect the blood sample and make a note on the requisition about the date of birth discrepancy for the laboratory to address. Option C. Politely inform the patient of the discrepancy and request confirmation of their date of birth from their medical record or a reliable source before proceeding with the collection. Option D. Immediately discard the requisition and ask the patient to obtain a new one to avoid any potential issues. The correct answer is C. Politely inform the patient of the discrepancy and request confirmation of their date of birth from their medical record or a reliable source before proceeding with the collection. Explanation. This scenario presents a common challenge in phlebotomy, ensuring the integrity of a patient sample when faced with potential pre-analytical errors. The professional challenge lies in balancing the need for accurate diagnostic results with patient safety and comfort, all while adhering to strict regulatory guidelines. Careful judgment is required to identify and mitigate risks that could compromise the specimen before it even reaches the laboratory. The correct approach represents best professional practice because it directly addresses the identified risk of pre-analytical error by implementing a corrective action that is both evidence-based and minimally invasive. This aligns with the fundamental principles of patient care and laboratory quality assurance, as mandated by regulatory bodies overseeing phlebotomy practice. Specifically, it prioritizes patient safety and the accuracy of diagnostic testing, which are paramount in healthcare. An incorrect approach that involves proceeding with the collection without addressing the identified issue would be a significant regulatory and ethical failure. This could lead to inaccurate test results, potentially resulting in misdiagnosis, inappropriate treatment, or delayed diagnosis, all of which compromise patient safety and violate the duty of care. Another incorrect approach, such as immediately discarding the sample and redrawing without a clear justification or patient consent, could be considered wasteful and may unnecessarily cause patient discomfort, potentially violating ethical guidelines regarding patient autonomy and resource management. Failing to document the observed issue and the corrective action taken would also be a regulatory failure, hindering quality control and traceability within the laboratory system. The professional reasoning process for similar situations should involve a systematic risk assessment. First, identify potential pre-analytical issues, e.g., patient identification discrepancies, improper specimen handling, incorrect collection tube. Second, evaluate the potential impact of each risk on the accuracy and reliability of the test results. Third, determine the most appropriate corrective action based on established protocols, regulatory requirements, and patient safety considerations. Fourth, implement the corrective action and meticulously document all steps taken. Finally, communicate any relevant information to the laboratory or healthcare provider to ensure appropriate interpretation of the results. Question 12. The performance metrics show a slight increase in patient apprehension during routine venipuncture procedures, particularly when patients appear visibly upset or confused. A phlebotomist is preparing to draw blood from a patient who is tearful and states, "I don't know if I can do this." The phlebotomist has already explained the procedure and its purpose. What is the most appropriate next step to ensure informed consent and patient well-being? Option A. Proceed with the blood draw quickly to minimize the patient's discomfort, assuming their presence implies consent for necessary tests. Option B. Inform the patient that the blood draw is medically necessary and that consent is implied by their appointment, then proceed with the collection. Option C. Gently reassure the patient that it's a common procedure and will be over quickly, then proceed with the venipuncture without further discussion. Option D. Pause the procedure, re-explain the process in simpler terms, and ask the patient to describe in their own words what will happen and why, while observing for signs of understanding and continued distress. Correct answer is D. Pause the procedure, re-explain the process in simpler terms, and ask the patient to describe in their own words what will happen and why, while observing for signs of understanding and continued distress. Explanation. Scenario analysis. This scenario presents a common challenge in phlebotomy where a patient's capacity to provide informed consent is questionable due to their emotional state. The phlebotomist must balance the need to obtain a necessary blood sample with the ethical and regulatory obligation to ensure the patient understands the procedure and its implications and can freely agree to it. Rushing the process or proceeding without clear consent risks violating patient rights and potentially causing harm. Correct approach analysis. The correct approach involves a multi-step process to assess and confirm informed consent. This begins with clearly explaining the procedure, its purpose, potential risks, and benefits in understandable language. Crucially, it requires actively seeking the patient's understanding and agreement, and observing for nonverbal cues that might indicate distress or lack of comprehension. If there is any doubt about the patient's capacity, the phlebotomist must pause and seek assistance from a supervisor or the patient's healthcare provider to determine the appropriate course of action, which might involve a surrogate decision maker. This aligns with best practices for patient autonomy and safety, as mandated by regulatory frameworks that emphasize patient rights and the necessity of voluntary, informed consent for medical procedures. Incorrect approaches analysis. Proceeding with the draw after a brief, unconfirmed verbal assent, without verifying understanding or assessing capacity, is a failure to obtain true informed consent. This bypasses the ethical requirement of patient autonomy and the regulatory mandate to ensure patients comprehend what they are agreeing to. It can lead to a patient feeling violated or distressed, and potentially grounds for a complaint or legal action. Assuming consent based on the patient's presence in the clinic or a general statement of needing blood work, without specific discussion of the current procedure, is also a significant ethical and regulatory lapse. Informed consent is procedure-specific. Patients have the right to know what is being done to them at the time it is being proposed. Ignoring signs of distress or confusion and proceeding with the draw because the phlebotomist believes the procedure is routine or necessary, demonstrates a disregard for patient well-being and autonomy. This approach prioritizes task completion over patient rights and can lead to adverse psychological outcomes for the patient, as well as regulatory noncompliance. Professional reasoning. When faced with a situation where a patient's capacity for informed consent is uncertain, a phlebotomist should follow a structured decision-making process. First, clearly and simply explain the procedure, its purpose, and any potential discomfort or risks. Second, actively solicit the patient's understanding and verbal agreement, observing their responses for clarity and confidence. Third, assess for any signs of confusion, distress, or reluctance. If any doubt remains about the patient's capacity to consent, the phlebotomist must not proceed independently. Instead, they should escalate the situation by consulting with a supervisor or the patient's physician to determine the best course of action, which may involve obtaining consent from a legal guardian or surrogate. This ensures patient rights are protected and that procedures are performed ethically and legally. Question 13. The control framework reveals that a certified phlebotomy technician is preparing to collect a blood sample from a patient in a busy outpatient clinic. Considering OSHA regulations and guidelines for workplace safety, which of the following actions best exemplifies a proactive risk assessment approach to ensure the safety of both the technician and the patient during this procedure? Option A. Conducting a brief visual scan of the immediate area for any obvious spills or misplaced sharps before gathering supplies, and mentally reviewing the steps of the procedure to anticipate potential challenges. Option B. Documenting any near misses or incidents that occurred during the blood draw to inform future training sessions, without altering the current procedure. Option C. Waiting for a supervisor to approve the safety measures before initiating the blood collection, even if no specific concerns are immediately apparent. Option D. Immediately proceeding with the venipuncture after confirming patient identification, assuming standard safety protocols are sufficient based on past experience. The correct answer is D. Immediately proceeding with the venipuncture after confirming patient identification, assuming standard safety protocols are sufficient based on past experience. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a phlebotomy technician to proactively identify and mitigate potential hazards in a common clinical setting. The challenge lies in moving beyond routine task execution to a systematic risk assessment process, which is crucial for preventing occupational injuries and ensuring patient safety. A phlebotomist must balance efficiency with a thorough understanding of potential exposures and implement appropriate controls. Correct approach analysis. The correct approach involves a comprehensive risk assessment that systematically identifies potential hazards associated with phlebotomy procedures, evaluates the likelihood and severity of associated risks, and implements appropriate control measures. This aligns directly with OSHA General Duty Clause, which requires employers to provide a workplace free from recognized hazards that are causing or are likely to cause death or serious physical harm. Specifically, OSHA Bloodborne Pathogen Standard 29 CFR 1910-1030 mandates exposure control plans, which are developed through risk assessment. This approach prioritizes prevention through engineering controls, administrative controls, and personal protective equipment (PPE), thereby minimizing the risk of needle stick injuries, exposure to infectious agents, and other potential harm. It demonstrates a commitment to a safe work environment and compliance with federal regulations. Incorrect approaches analysis. Focusing solely on immediate patient needs without a concurrent assessment of the environment or procedure risks is a regulatory and ethical failure. While patient care is paramount, it should not preclude the technician from adhering to safety protocols. This approach neglects the proactive hazard identification required by OSHA. Implementing controls only after an incident has occurred is reactive rather than preventative. OSHA regulations emphasize proactive measures and the establishment of a comprehensive safety program. Waiting for an injury to implement controls means that potential harm has already materialized, violating the spirit and letter of OSHA requirements for hazard mitigation. Relying exclusively on personal experience without formalizing a risk assessment process is insufficient. While experience is valuable, it may not encompass all potential hazards or ensure consistent application of safety measures across all staff and situations. OSHA mandates a structured approach to safety, not one that is solely dependent on individual expertise, without a documented and systematic process. Professional reasoning. Professionals should adopt a proactive, systematic approach to safety. This involves 1. Hazard identification, recognizing potential risks in the work environment and during procedures, e.g., sharps, biohazards, ergonomic strain. 2. Risk evaluation, assessing the probability of an incident occurring and the potential severity of its consequences. 3. Control implementation, selecting and applying appropriate controls, prioritizing engineering controls, followed by administrative controls, and finally PPE. 4. Monitoring and review, regularly evaluating the effectiveness of controls and updating the risk assessment as needed. This framework ensures compliance with OSHA regulations and fosters a culture of safety. Question 14. The risk matrix shows that arterial puncture procedures carry a higher potential for complications compared to routine venipuncture. A certified phlebotomy technician receives a physician's verbal order to perform an arterial puncture for an arterial blood gas (AB) analysis on a patient. The technician is aware that ABGs are critical for assessing respiratory function. What is the most appropriate and professionally responsible course of action for the certified phlebotomy technician in this situation, adhering strictly to U.S. regulatory frameworks for phlebotomy practice? Option A. Perform the arterial puncture without further inquiry, assuming that any physician's order for a procedure implies the technician is authorized and trained to perform it. Option B. Immediately proceed with the arterial puncture, as the physician's order indicates the necessity of the test and the technician is aware of the test's importance. Option C. Verify with the ordering physician or a supervisor whether arterial puncture is within the technician's scope of practice and if they have received specific training and competency validation for this procedure. Option D. Inform the physician that a venipuncture can provide similar information and suggest performing a venous blood draw instead. Correct answer is B. Immediately proceed with the arterial puncture, as the physician's order indicates the necessity of the test and the technician is aware of the test's importance. Explanation. Scenario analysis. This scenario presents a challenge because arterial puncture, while sometimes necessary for specific diagnostic tests, carries a significantly higher risk profile than venipuncture. The primary risks include arterial spasm, hemorrhage, thrombosis, nerve damage, and infection. A phlebotomist must possess advanced knowledge and skill, and critically, must operate within the defined scope of practice and established protocols. The decision to perform an arterial puncture, or to assist in one, requires a thorough understanding of the patient's condition, the specific test ordered, and the potential complications, as well as the institution's policies and the phlebotomist's training and competency. Correct approach analysis. The correct approach emphasizes adherence to established protocols and the phlebotomist's scope of practice. In the U.S., phlebotomists are typically trained and certified for venipuncture. Arterial puncture is a more complex procedure usually performed by physicians, nurses, or respiratory therapists. Therefore, the most professional and legally sound action for a certified phlebotomist, when faced with an order for arterial blood gas (AB analysis), is to verify the order and confirm that the procedure is within their authorized scope of practice, and that they have received specific, documented training and competency validation for arterial puncture. If it is outside their scope, or they lack the necessary training, they must escalate the situation to a supervisor or the ordering physician to ensure the procedure is performed by a qualified individual. This aligns with the principle of practicing within one's competency and adhering to institutional policies, which are often guided by CLIA, Clinical Laboratory Improvement Amendments, regulations regarding personnel qualifications and laboratory practice. Incorrect approach is analysis. Performing the arterial puncture without explicit confirmation of scope of practice and specific training is a direct violation of professional standards and potentially legal statutes governing phlebotomy practice. It exposes the patient to undue risk and the phlebotomist to liability. This action disregards the principle of patient safety and practicing within one's authorized limits. Suggesting a venipuncture as a substitute for an arterial blood gas (AB test is medically inappropriate and demonstrates a lack of understanding of the diagnostic purpose of an ABG. ABGs are specifically ordered to assess oxygenation, ventilation, and acid-base balance, which cannot be accurately determined from venous blood. This approach fails to meet the patient's diagnostic needs and is a failure of professional judgment. Immediately proceeding with the arterial puncture based solely on the physician's verbal order without verifying scope of practice or ensuring proper training is a critical error. It bypasses essential safety checks and assumes a level of authorization and competency that may not exist. This action prioritizes expediency over patient safety and regulatory compliance. Professional reasoning. Professionals should employ a decision-making process that prioritizes patient safety, regulatory compliance, and ethical practice. This involves 1. Understanding the specific test ordered and its diagnostic significance. 2. Knowing one's own scope of practice and institutional policies. 3. Verifying orders and seeking clarification when necessary. 4. Ensuring proper training and competency for any procedure performed. 5. Escalating issues to appropriate personnel when a procedure is outside one's scope or requires further authorization. In this case, the phlebotomist must first determine if arterial puncture is within their certified scope and if they have received appropriate training and competency validation. If not, they must communicate this to their supervisor or the ordering physician to ensure the patient receives the correct test performed by a qualified professional. Question 15. Governance review demonstrates a phlebotomy technician is preparing to draw blood from a patient presenting with significant swelling in the left arm. The technician notes the swelling is localized and appears to be related to impaired fluid drainage. Considering the role of the lymphatic system in fluid balance and immune function, what is the most appropriate course of action for the phlebotomist? Option A. Document the swelling and immediately cancel the blood draw until a physician can assess the lymphatic issue. Option B. Inform the patient that the swelling is not a concern and proceed with venipuncture in the left arm. Option C. Attempt venipuncture in the swollen left arm, as the lymphatic system does not directly impact blood collection. Option D. Proceed with venipuncture on the unaffected right arm, documenting the observation of swelling and the decision to use the alternate arm. Correct answer is D. Proceed with venipuncture on the unaffected right arm, documenting the observation of swelling and the decision to use the alternate arm. Explanation. Scenario analysis. This scenario presents a challenge in understanding the broader physiological context of phlebotomy beyond simple blood collection. A phlebotomist must recognize how the body systems interact, particularly when a patient's condition might be influenced by or affect lymphatic function. Misunderstanding this can lead to incorrect patient assessment or inappropriate actions. Correct approach analysis. The correct approach demonstrates an understanding that the lymphatic system plays a crucial role in fluid balance and immune response. While not directly involved in blood collection, its function is interconnected with overall circulatory health. Recognizing that swelling edema can be a sign of lymphatic dysfunction, which might contraindicate or require special considerations for venipuncture, e.g., avoiding the affected limb due to impaired circulation and increased risk of infection or hematoma, represents best professional practice. This aligns with the ethical responsibility to ensure patient safety and provide competent care, adhering to the implicit guidelines of maintaining patient well-being as a priority in any healthcare procedure. Incorrect approaches analysis. One incorrect approach fails to recognize the significance of visible edema, treating it as a minor cosmetic issue. This overlooks potential underlying physiological problems related to fluid imbalance or impaired circulation, which could affect phlebotomy site selection and patient safety. This demonstrates a lack of comprehensive patient assessment and a failure to consider factors that could complicate the procedure, potentially violating patient care standards. Another incorrect approach incorrectly assumes that lymphatic swelling is irrelevant to blood collection, focusing solely on the venous system. This shows a deficiency in understanding the interconnectedness of bodily systems and the potential impact of one system's dysfunction on another. It neglects the possibility that compromised lymphatic drainage could affect tissue integrity and healing at the venipuncture site, increasing the risk of complications. A further incorrect approach might involve proceeding with venipuncture in an obviously edematous limb without considering the implications of impaired lymphatic drainage. This demonstrates a disregard for potential complications such as increased risk of infection, delayed healing, or inaccurate sample integrity due to altered tissue fluid. It represents a failure to exercise due diligence and prioritize patient safety, potentially contravening established phlebotomy protocols designed to mitigate such risks. Professional reasoning. Professionals should approach patient care with a holistic perspective, understanding that various bodily systems are interconnected. When faced with a patient exhibiting signs of potential systemic issues, such as edema, a phlebotomist should pause to assess the implications for the planned procedure. This involves considering how the observed condition might affect the safety, accuracy, and efficacy of the phlebotomy. If unsure, consulting with a supervisor or nurse is a critical step in ensuring patient safety and adhering to best practices. Question 16. Stakeholder feedback indicates a need to reinforce best practices for specimen collection, timing, and order of draw. A physician has ordered a blood culture, a prothrombin time (PT) test, and a complete blood count (CBC) for a patient. The patient is not fasting, and the blood culture is to be drawn immediately, with the PT and CBC to follow as soon as possible. The phlebotomist has a standard set of evacuated tubes available. Which of the following approaches best ensures specimen integrity and accurate test results in this scenario? Option A. Collect the blood culture using sterile technique, then collect the PT tube followed by the CBC tube, ensuring proper mixing of each tube. Option B. Collect the CBC tube first, then the PT tube, and lastly the blood culture tube, as the CBC is a common screening test. Option C. Collect the blood culture using sterile technique, then the CBC tube followed by the PT tube, ensuring proper mixing of each tube. Option D. Collect the PT tube first to get it out of the way, then the CBC tube, and finally the blood culture tube to minimize patient discomfort. The correct answer is A. Collect the blood culture using sterile technique, then collect the PT tube, followed by the CBC tube, ensuring proper mixing of each tube. Explanation. This scenario presents a common challenge in phlebotomy, managing multiple specimen collection requests with varying timing requirements and potential for cross-contamination or interference. The professional challenge lies in prioritizing patient safety, specimen integrity, and adherence to established protocols to ensure accurate diagnostic results. Careful judgment is required to interpret physician orders, understand the implications of specimen timing, and execute the collection process efficiently and safely. The correct approach represents best professional practice because it prioritizes the most time-sensitive and potentially interfering tests first, followed by less critical or less susceptible tests, all while adhering to the standard order of draw to prevent additive carryover. This systematic approach minimizes the risk of erroneous test results, which could lead to misdiagnosis or inappropriate treatment. Adherence to the established order of draw, as outlined by regulatory bodies and laboratory guidelines, is a critical safety and quality control measure. An incorrect approach that prioritizes convenience over specimen integrity would be professionally unacceptable. For example, collecting a blood culture specimen after other evacuated tubes without changing the needle or using a sterile technique would introduce a high risk of contamination, rendering the culture results unreliable. This violates fundamental principles of aseptic technique and specimen integrity, potentially leading to false positive or false negative results. Another incorrect approach, such as collecting a coagulation tube before a blood culture without proper consideration for the order of draw, risks introducing anticoagulant into the blood culture, which could inhibit bacterial growth and lead to a false negative result. This demonstrates a failure to understand the critical interdependencies between different tube additives and their impact on specific tests, a core competency for a certified phlebotomy technician. Professionals should employ a decision-making framework that begins with a thorough review of all physician orders, noting any specific timing requirements, e.g., fasting, postprandial time draws. Next, they should consult the laboratory's specific guidelines for the order of draw, understanding the rationale behind each tube type's placement. Multiple tubes are required. The phlebotomist must mentally sequence the collection, prioritizing sterile collections, blood cultures, and then tubes with additives that can interfere with other tests, e.g., coagulation tubes, serum tubes with clot activators, before tubes with less reactive additives or no additives. If a patient has multiple time draws, the phlebotomist must coordinate with nursing staff to ensure the draws are performed at the correct intervals. And if multiple draws are due simultaneously, the phlebotomist must apply the order of draw principles to the collection sequence. Question 17. Cost-benefit analysis shows that a thorough understanding of the heart structure, including the distinct roles of the atria, ventricles, and valves in the cardiac cycle, is crucial for a certified phlebotomy technician. Which of the following best describes the practical application of this knowledge in phlebotomy practice? Option A. Memorizing the names of the 4 chambers of the heart and their general location within the thoracic cavity. Option B. Understanding that the heart pumps blood, without needing to differentiate between the functions of the atria and ventricles. Option C. Recognizing how the pressure gradients and blood flow patterns dictated by the heart's chambers and valves can influence vein selection and the risk of complications like hematomas or syncope. Option D. Focusing on the electrical conduction system of the heart, as this is more relevant to patient monitoring during blood draws. The correct answer is C. Recognizing how the pressure gradients and blood flow patterns dictated by the heart's chambers and valves can influence vein selection and the risk of complications like hematomas or syncope. Explanation: the scenario presents a challenge for a certified phlebotomy technician, CPT, who needs to understand the structural components of the heart to accurately identify potential complications or contraindications related to blood draws, particularly in patients with known cardiac conditions. This requires more than just rote memorization. It demands an understanding of how the heart's structure influences its function, and by extension, patient safety during phlebotomy. The CPT must apply this knowledge to interpret patient information and make informed decisions about the procedure. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of cardiac anatomy and physiology, directly linking it to phlebotomy safety. A CPT who can articulate the roles of the atria, ventricles, valves, and major vessels in blood circulation is better equipped to recognize how conditions affecting these structures, e.g., valvular heart disease, congestive heart failure affecting ventricular function, might impact blood draw sites, pressure, or the risk of complications. This aligns with the ethical imperative to provide safe and competent patient care, as mandated by general healthcare practice standards, and implied in the scope of practice for a CPT, which emphasizes patient well-being and adherence to safety protocols. An incorrect approach that focuses solely on superficial knowledge of the heart's chambers, without understanding their function or interrelationships, is professionally unacceptable. This would be a regulatory failure because it indicates a lack of the necessary competency to perform duties safely and effectively, potentially leading to patient harm. For instance, not understanding the pressure differences between the atria and ventricles could lead to improper vein selection or inadequate pressure application post-draw, increasing the risk of hematoma or other complications. Similarly, an approach that prioritizes speed over accurate anatomical understanding, or one that dismisses the relevance of cardiac structure to phlebotomy, demonstrates a disregard for patient safety and a failure to meet the expected standards of a certified professional. Professional decision-making in such situations requires a systematic approach. First, assess the patient's medical history for any cardiac conditions. Second, recall the relevant cardiac anatomy and physiology and how it might be affected by the patient's condition. Third, consider how these anatomical and physiological factors directly impact the phlebotomy procedure, e.g., vein integrity, potential for bleeding, patient tolerance. Finally, consult with a supervisor or physician if there is any uncertainty about the patient's suitability for phlebotomy or the safest approach. This iterative process ensures that patient safety remains paramount and that the CPT acts within their scope of practice and ethical obligations. Question 18. Assessment of the appropriate equipment selection for a patient presenting with visibly fragile and superficial veins, requiring a routine venipuncture for laboratory testing using the vacutainer system. Option A. Employ an 18-gauge needle with the vacutainer system for rapid collection. Option B. Use a syringe for blood collection and then transfer to vacutainer tubes without a needle. Option C. Utilize a 23-gauge butterfly needle attached directly to a vacutainer tube holder. Option D. Attempt venipuncture with a standard 21-gauge needle and vacutainer tube. Correct answer is C. Utilize a 23-gauge butterfly needle attached directly to a vacutainer tube holder. Explanation: scenario analysis. This scenario presents a common challenge in phlebotomy, selecting the appropriate equipment for a patient with fragile veins. The professional must balance the need for a successful blood draw with the patient's comfort and safety, while strictly adhering to established protocols. Failure to do so can lead to patient injury, specimen rejection, and regulatory noncompliance. Correct approach analysis. The correct approach involves using a smaller gauge butterfly needle with a syringe or a direct draw into a vacutainer tube. This method is best professional practice because smaller gauge needles, e.g., 23 gauge, are less traumatic to fragile veins, reducing the risk of hematoma formation, vein collapse, and patient discomfort. The vacutainer system, when used with a butterfly needle, allows for controlled collection, minimizing the need for multiple venipuncture attempts. This aligns with regulatory guidelines that emphasize patient safety and the collection of quality specimens. Incorrect approach is analysis. Using a standard 21-gauge needle with the vacutainer system is incorrect because this larger gauge needle is more likely to cause trauma to fragile veins, increasing the risk of hematoma, vein collapse, and patient pain. This directly contravenes the principle of minimizing patient harm. Attempting to draw blood using only a syringe without a needle is fundamentally incorrect, as it bypasses the mechanism for venipuncture and is not a recognized phlebotomy technique for routine blood collection. This demonstrates a lack of understanding of basic phlebotomy procedures and equipment. Using a large bore, e.g., 18-gauge, needle with the vacutainer system is highly inappropriate for routine phlebotomy, especially with fragile veins. Such needles are typically used for blood donation or therapeutic phlebotomy and would cause significant trauma and pain to a patient with delicate vasculature, leading to potential complications and specimen hemolysis. Professional reasoning. Professionals should first assess the patient's vein integrity. If veins appear fragile, the decision-making process should prioritize the least invasive and least traumatic equipment. This involves consulting established phlebotomy protocols and manufacturer guidelines for needle selection based on vein condition and the type of collection. If unsure, seeking guidance from a supervisor or experienced colleague is a crucial step in ensuring patient safety and regulatory compliance. Question 19. Comparative studies suggest that the choice of blood collection tube additives significantly impacts the accuracy of various laboratory assays. A physician orders a complete blood count (CBC) and a prothrombin time (PT) test. Which combination of blood collection tubes would be most appropriate to ensure accurate results for both tests? Option A. A red top tube containing no additive and a green top tube containing heparin. Option B. A gold top tube containing a clot activator and a light blue top tube containing sodium citrate. Option C. A gray top tube containing potassium oxalate and a lavender top tube containing EDTA. Option D. A lavender top tube containing EDTA and a light blue top tube containing sodium citrate. The correct answer is D. A lavender top tube containing EDTA and a light blue top tube containing sodium citrate. Explanation. Scenario analysis. This scenario is professionally challenging because the phlebotomist must accurately identify the correct blood collection tube for a specific laboratory test, considering the presence of additives that can interfere with or facilitate the testing process. Misidentification can lead to erroneous test results, patient harm, and significant financial implications for the healthcare facility. The phlebotomist's judgment is critical in ensuring patient safety and the integrity of diagnostic information. Correct approach analysis. Selecting the tube with the appropriate additive e.g., EDTA for hematology, citrate for coagulation studies, heparin for chemistry tests is best professional practice. This aligns with CLIA, Clinical Laboratory Improvement Amendments, regulations, which mandate accurate specimen collection and handling to ensure the reliability of laboratory test results. Adhering to manufacturer instructions for use (IFU) for each tube type and following established laboratory protocols are essential to prevent pre-analytical errors. Incorrect approach is analysis. Choosing a tube without considering the specific laboratory test ordered is a regulatory failure under CLIA, as it compromises the accuracy and reliability of the test results. This can lead to misdiagnosis or delayed treatment. Selecting a tube with an incompatible additive for the requested test is also a significant pre-analytical error. For example, using a serum separator tube, SSD, for a coagulation study would introduce fibrin clot activators, rendering the results invalid and violating CLIA quality control standards. Using a tube that has expired or shows signs of damage, e.g., compromised vacuum seal, is a direct violation of laboratory safety and quality control protocols, which are implicitly covered by CLIA mandate for accurate testing. This can lead to collection failures or specimen contamination. Professional reasoning. Professionals should employ a systematic decision-making process. First, they must clearly identify the specific laboratory test requested. Second, they should consult the laboratory's test directory or the requisition form for the recommended blood collection tube and additive. Third, they must verify the correct tube is available within its expiration date and properly sealed. Finally, They should confirm their understanding of the additive's function and its compatibility with the ordered test before proceeding with the collection. Question 20. Strategic planning requires a phlebotomist to anticipate potential patient needs during a blood draw. If a patient requires a second venipuncture due to an initial collection error, what is the most appropriate and safest course of action regarding equipment? Option A. Recap the used needle and then use it for the second venipuncture. Option B. Reuse the same needle for the second venipuncture, ensuring it is still sharp. Option C. Use a new needle but reuse the same collection tube holder for the second venipuncture. Option D. Use a new, sterile needle and collection device for the second venipuncture. The correct answer is D. Use a new, sterile needle and collection device for the second venipuncture. Explanation. Scenario analysis. This scenario presents a common challenge in phlebotomy, balancing patient safety with efficient workflow. A phlebotomist must adhere strictly to standard precautions to prevent the transmission of infectious agents, even when faced with time pressures or perceived minor risks. The professional challenge lies in recognizing that all bodily fluids carry potential pathogens, and that deviations from protocol, however small, can have significant consequences for patient and healthcare worker safety. Correct approach analysis. The correct approach prioritizes the integrity of the specimen and the prevention of cross-contamination by using a new, sterile needle and collection device for each patient. This aligns directly with the Centers for Disease Control and Prevention (CDC) guidelines for standard precautions, which mandate the use of sterile, single-use equipment for venipuncture. This practice is ethically sound as it upholds the principle of non-maleficence, do no harm, by minimizing the risk of infection transmission to both the patient and the phlebotomist. It also ensures the accuracy and reliability of laboratory test results, which is crucial for patient diagnosis and treatment. Incorrect approaches analysis. Reusing a needle, even for the same patient, poses a significant risk of introducing bacteria from the skin's surface into the bloodstream, potentially leading to a localized infection at the venipuncture site or a systemic infection. This violates standard precautions and the principle of non-maleficence. Using a needle that has been previously used and then recapped is a direct violation of standard precautions. Recapping needles is a high-risk activity for needle stick injuries, which can transmit serious blood-borne pathogens like HIV and hepatitis B/C. This is a critical ethical and regulatory failure. Using a needle that has been previously used and then recapped, even if the patient is the same, is a direct violation of standard precautions. Recapping needles is a high-risk activity for needle stick injuries, which can transmit serious blood-borne pathogens like HIV and hepatitis B/C. This is a critical ethical and regulatory failure. Professional reasoning. When faced with a situation where a patient requires a second venipuncture, a phlebotomist must always revert to the fundamental principles of standard precautions. This involves a systematic assessment of the situation, recognizing the potential for infection transmission, and applying the established protocols for safe patient care. The decision-making process should prioritize patient safety and regulatory compliance above all else, even if it means a slight delay in the procedure. The phlebotomist should always have a fresh, sterile venipuncture kit readily available to address such situations efficiently and safely.